Hello, future athletic trainers. My name is Dr. Jay Hoffman. I'm the chair of athletic training and health sciences at Culver-Stockton College, where I also serve as the role of program director of the Masters of Athletic Training. It's my pleasure to talk to you a little bit today about athletic training, healthcare for work, life, and sport. In this professional overview, we're going to be looking at and defining athletic training as a profession. We're going to look at what the job market looks like now and what your earning potential may be as an athletic trainer. We want to take a quick review of the certification and educational requirements to become an athletic trainer. And finally, let's talk about and explore post-professional specialties and residencies. So what is an athletic trainer? Well, athletic trainers are multi-skilled healthcare professionals who collaborate with physicians to provide prevention services, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation of injuries in medical conditions. And we also take care of the professional well-being and the healthcare administrative components that go along with being a healthcare professional. So we can't just think of athletic trainers as working on a sideline and distributing water or taping. It's a healthcare profession that goes well beyond those basic skills. So where do we work? The important thing to note here again is that we don't only work in what's called the traditional setting, or we often refer to as the traditional setting, where it's college, university, and professional sports. Only 39% of athletic trainers are found in these three locations, according to the National Athletic Training Association. We also see athletic trainers in hospitals, ERs, clinics, and they have specialties in sports medicine, cardiac rehab, medical fitness, wellness, and in some cases you'll see dual credentialed athletic trainers who also have the physical therapy or occupational therapy credential as well. But areas where we're really starting to see some growth and maturation in the profession is what we call the non-traditional or practice advancement areas. These can include occupational health, kind of in commercial settings and manufacturer settings, really focusing on areas such as workman's comp and ergonomics. We also see athletic trainers in civil service, where there's police and fire departments and branches of the military. And then we're also seeing athletic trainers in areas like performing arts and the professional and collegiate dance. And you even have athletic trainers in performing groups such as marching bands and Cirque du Soleil in Las Vegas. So the important thing to remember here is that athletic trainers are healthcare. Again, you don't find us only in the traditional sports medicine setting. Our skill set transcends just the student athlete or just the professional athlete and extends into all kinds of physically active populations. So what does the job outlook look like? Well, right now it's excellent. Athletic training is one of the fastest growing medical professions, according to the U.S. Department of Labor and Statistics. We're looking at over 23% projected growth by 2026. And the interesting thing here is we've seen the last couple decades, we've really seen a shift in the gender demographic of the athletic training profession. Upwards of 63% of athletic trainers are females. And I think part of that is because we're seeing an improvement and an increased balance with work and life. So what we're also seeing is we're seeing an increase in sport participation at the high school level and an increased awareness of concussion, including concussion bills that are increasing and improving job opportunities for athletic trainers. We're also seeing a population that is more active into middle-aged years. And again, this is a physically active population that is well served by athletic trainers. Then again, as I referenced before, we're seeing workman's comp mitigation, increased workplace productivity, and so why we're seeing those increase in job opportunities in the industrial corporate area. So if you look at this in comparison to other professions, so again, according to the U.S. Department of Labor and Statistics, we're looking at a 23% job growth in athletic training, which is 2 times that of all other healthcare professions put together, and 3 times that of all occupations. So again, very good job growth in athletic training. But at the same token, while the job market may be good, we need to make sure that we can make good earnings too. We're obviously going to take on debt, especially as athletic training moves into the master's level of education. As we take on more debt, we need to make sure that we can offset that with appropriate income. Again, you're going to note here the income again reported by the National Athletic Training Association over the past 10 years. You'll note that there is about a $13,000 increase in the average annual salary according to the NATA. But it is really important to note that it really will depend on your geographical setting, your location, level of education, So there's a lot of variables that go into this. So you're going to want to take a look at the area and setting that you're interested in, look at your level, your degree level, and 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 make a appropriate uh, estimate as to what your salary may be. But what we will note here is if we look at all other U.S. professions, we have an average salary of about $37,000 compared to say $64,000 per year in other healthcare professions combined. Whereas the athletic trainer is right there in the middle, skewed more towards other healthcare professions at $57,000 per year. If you look at that from a wage perspective, you're looking at somewhere between $28 and $39 per hour. And again, this is looking at the sport versus the hospital industrial setting. So sport's going to be, or the traditional setting is going to be towards the lower end of that scale, whereas the hospital industrial setting is going to be towards the higher end of that scale. So where are the highest paying jobs? Those are typically in academia, NCAA Division I sports, as well as professional sports. And then the latter two, as I just mentioned, the hospital clinic or the industrial corporate setting. There is a common combination, again, dual credentialed individuals where we do see an increase in salary and wage. That's typically coupled with the PhD EDD. Again, that's in academia, as well as CSCS credentials, which might be kind of in a split appointment in hospital clinic or comboed with some sort of sports medicine component. So what does this look like? Again, this is from a summary document from the National Athletic Trainers Association, and the blue highlights some of the higher paying areas in athletic training, whereas red highlights those in the lower paying areas. So again, most students, their exposure to athletic trainers, especially at the collegiate level, have been in your NCAA Division II, Division III, possibly some Division I, NAIA, and even the high school type settings. And this is where you're first exposed to athletic training. And sometimes it may give a misconception as to what the pay scales are like in athletic training as a whole. If you'll note here, those settings where students are often exposed to athletic training as a profession are also those areas where they're the lowest paying, as well as there's maybe a little less or a little more work strain or a little less work-life balance, or it's a little more challenging to have. It doesn't mean you can't have it, it just means it's a little more challenging. Whereas in those areas where you may have a little bit more work-life balance, as we get into the industrial corporate, we look at the hospital and orthopedics, possibly the military, and then again, college faculty and research here in hospital administration, where you start to see those salaries move up more towards that average 57,000 that we discussed earlier. So again, industrial ergonomics here, we're looking at about 56.8, military 59.3, hospital orthopedics, and again, another industrial occupational corporate around that 61,000 mark. So what's the educational overview? Well, if you're looking at an athletic training education program, you need to make sure that you are looking at a program that is CATI accredited. So that's the Commission on Accreditation of Athletic Training and Education. The school must be CATI accredited in order for you to be eligible for the Board of Certification or your ATC certification. Everybody is required. There's a master's mandate. So 2022 programs will no longer be allowed to accept bachelor level candidates, and all education will be shifting to the master's only. And you're looking at different types of masters, whether it's a master's of science in athletic training, maybe it's a master's of athletic training. The minor differences between those two are typically have to do with a research component or a thesis component. The MS oftentimes has the thesis component, and MAT may have more of a clinical focus or hands-on focus. You must have a minimum of 2 years of clinical experience. That is, again, with the CATI accreditation and those 2 years of experience, you then are eligible for the Board of Certification so long as you complete your program. Once you receive that BOC certification, you must maintain your continuing education. And at this point in time, that's 50 CEUs every 2 years, with 10 of those being evidence-based practice. That is subject to change along the way, but those are the current standards and requirements for continuing education. There is also post-professional education. You can look at doctoral degrees. You also can look at residencies and fellowships to improve and or create areas of specialty or specialization within the skill set of athletic training. So what do some of those specializations or residencies look like? If you pull up the NATA Career Center, you'll find these all over the place. There is also accredited residencies and fellowships that go through the CATI process as well. Again, the Commission on accreditation of athletic training education. So if you look here, here's some of the KD approved residency specialty areas. We're looking at prevention and wellness, urgent and emergent care, primary care, orthopedics, rehabilitation, behavioral health, pediatrics, and performance enhancement. Again, if you go onto the website, you will find different uh, advertisements. I'm not endorsing any one of these just because it's on the presentation, but only to note that you can go on to the NATA Career Center and find those, as well as a list of KD approved residencies on the KD website. So thank you very much for your time. I hope that gave you a little bit of insight into what athletic trainers are and what the opportunity is for jobs, as well as potential pay. And then subsequently the education that's required to become an athletic trainer. We hope that you take some time to talk with us at Culver-Stockton College and talk about the opportunities in our Masters of Athletic Training, where you can accelerate your career in healthcare. And remember, athletic training is healthcare for work, life, and sport.